Welcome to Astrodology, the podcast that brings you knowledge, wisdom, and principles that can help you find the peace and comfort we all seek and deserve in our lives. Hi, everybody. Thank you for tuning in to another episode of Astrodology with Astrid. I hope you've been taking really good care of yourself. There is a lot going on in this world that we're living in, and the collective trauma just keeps building. It's not relenting just yet. So this topic today is very near and dear to my heart because June is dedicated to men's health. And I love that because for so long, men have been guilty of just not taking care of themselves to the level that they should or could. It's important that we understand the why and what's really affecting men and their health, because we need men in order to keep this planet rolling. We need guys. And personally for me, this is very close to my heart because I love men and I have great men in my lives. Of course, my wonderful sons, my brother, my uncles, my cousins. And then I have a great circle of male friends. I think more than the average woman. I truly have these true blue, amazing men in my life that I honor and respect so much. What's refreshing to me, my working in nutrition and supplementation, I am personally seeing an uptick in men taking care of themselves. I mean, the clients that I work with, they're doing the work. And actually, I have several male customers who they're doing the work physically, mentally, emotionally. They're taking the supplements. And then they bring information back to me that I don't have time to yet study or deep dive into. In fact, one of my customers, he is a superstar when it comes to taking care of himself. In fact, it's kind of he outweighs his wife because typically women, are known to take better care of themselves. In this case, it's flip. But anyway, let's get into this topic because June is dedicated to men's health. And before this month closed out, I wanted to throw my hat in the ring and just bring up some topics that I hope that you, as men and women, you can maybe share with your men about taking care of themselves. I start with a quote from the book Ayurveda by Robert E. Svoboda. Now, Ayurvedic medicine, what I love about it is that it looks at the whole person from the emotions, from the dosha standpoint, from the mental and dietary. Every side of the human being is looked at and valued. I think in our Western medicine world, when people go to the doctor these days, you just don't feel valued. And I have a story of my own to share upcoming. But let's get into this. Here's the quote. "This life is the only life you as yourself will ever have, and you owe it to yourself and the world to make the best of yourself. The pursuit of life, the pursuit of wealth, and the pursuit of the afterlife are the three main things. Most important of these three is the pursuit of life, which implies the pursuit of health, for without health, one cannot enjoy life or achieve one's aims. As health is impossible without right relationship, affluence, satisfaction, and at least a certain degree of non-attachment, one must simultaneously guard both one's health and one's direction in life." It goes on to say, "An intellectual man should therefore specifically devote himself to those endeavors which assure the body's well-being. The body is truly the support of one's well-being, since human beings are established in the body. Leaving everything else, one should take care of the body. For the absence of the body, there is the total extinction of all that characterizes embodied beings." So when you think about it, no body, no people. Okay, so I decided to look up, asked a couple questions. Why do men struggle to take care of themselves? Because I've never understood it. It's so classic that men they go to the doctor at the last minute, they put things off. to the chagrin of their loved ones. Please go to the doctor, and they'll put it off and put it off. It'll ensue into a big argument or explosion, and then the guy finally goes to the doctor. So one of the things, and this is just a male quality, just like there are qualities for women, but time constraints comes through as the number one reason why men struggle to take care of themselves. Oftentimes men are juggling multiple responsibilities, especially if it's a household where it's more traditional, where the man is the breadwinner and the woman takes care of the household and the family and the kids and the raising. So this can limit the time for self-care or personal development. Time constraints also get included. Men can be workaholics and overwork, wanting to achieve and move up the ladder, etc. There's also one that came through that said lack of awareness, and I think this is really potent. Some men, men are said to be very simple, and that women, we overcomplicate men. Some of the thoughts we have about men, or wondering why they do this, why they do that, comes down to very simple things. They just didn't recognize it, So some men don't recognize that it is an actual benefit in investing in themselves. They invest at work, they invest in their family, they maybe even invest in their sporting events, their music, but not investing in themselves. But by the way, if you're doing something, enjoyment of life, like if you're doing sports that you love or participating in sporting events, I think that qualifies as self-care because you are unplugging from work. So men just don't see the benefit of investing in themselves, whether it's through grooming themselves. That's a big pet peeve of mine, male grooming. Men love a beautiful woman. They love a woman with beautiful hair and skin and nails and all of that. But so wild to me that men don't think that they have to do the same thing. Hey, women, we like a fresh, clean man. I can't tell you how many guys I've dated who had breath that was not fresh, and then had the nerve to get offended when it was called out. But because I want the best for them, and because it would be hard for me to be intimate with someone who had unfresh breath. And so not to harp on that, but also emotional well-being. So fashion, grooming, emotional well-being. When you look good, you feel good. And I just feel like that's something that the average man, of course there are men that know this, but the moral majority of men don't understand or get this. Why don't men take care of themselves was the other question I asked. And the thing came back is because men are so busy proving their worth and their worth and prove themselves through accolades, through bonuses, through titles, through promotions and things like that. So they feel unworthy when it comes to things like that. So this mindset gets justified. So men will skip out on exercise. They'll get very little sleep. And they'll have signs for them to slow down, to take life at a slower pace, or signals to eat. I think diet is one of the big things that men are guilty of. Men can go hours and hours and they create this crazy pattern of just eating last minute, and then when they finally eat, they eat something that's not very healthy. So this idea of the man focusing on winning puts men in competition with other men and also with themselves. So then working out, when men finally do work out, when they go to the gym, it goes to who can lift the most. And then when men do focus on eating and they bring it to a competitive lens, it's about who can pack away the most amount of food or who can finish what's ever on the plate. And it's not really about the enjoyment of the food. But it's very subtle and it's very constant that men compare themselves. And there's this idea, there's this invisible ladder with rungs on it. And so men are always comparing and contrasting where they might fit on the rung. The man box mindset says that slowing down or accepting physical limitations will undermine your ambitions. It'll make you seem weak or ineffectual. Moreover, the man box has no patience for the long journey of creating sustainable habits. I know women are impatient, but men are super impatient. If men really, their personality style, and again, I'm generalizing here, obviously not all men, but a lot of men want quick wins. They want things to just move along, and they don't want the messy, the deep work that goes into listening to and trusting your body. Sometimes men, one of the things that comes through is that men equate self-care with femininity. And this is a burden of the patriarchy. But again, I'm starting to see this being reversed, where more and more men are actually getting manicures and pedicures. You're not getting color on their nails, but they're realizing, your hands actually feel better. They look good when you get a manicure and pedicure. So this value that men have carried about being independent and self-reliance runs very heavy in the male psyche. The problem is, it's not leading to self-care. It's leading more to avoidance and denial about taking care of themselves. So this idea of winning keeps men in a competitive edge with other men and with themselves. And it's very sad because it can be very exhausting. Another question I asked, why do men neglect themselves? Self-neglect is said is rooted in cultural norms. And again, this is not a bad thing, because traditionally men put themselves last, especially, the originating masculinity of hunter and gathering and taking care of the family. But there are many, the broader social expectations of men neglecting themselves is starting to narrow down. But when men neglect themselves, it's scary because mental illness rises, poverty rises, and isolation from family and friends arise. In 2025, key men's health issues include heart disease, cancer, particularly prostate and lung, mental health challenges, diabetes, and the impact of unhealthy lifestyles is growing. Many of these issues, sadly, are preventable with early intervention and sometimes with very simple lifestyle changes. Heart disease remains the leading cause of death for men across various demographics. Now, I quoted this statistic back in 2000. When I started teaching yoga, heart disease was the number one killer of men. And here it is, 25 years later, it's still at the top. Prostate cancer. Many of us are 1, 2, or 3 degrees of separation from knowing a man who had to battle prostate cancer. And it's the second most common cancer in men. And lung cancer also poses a significant risk. But again, early detection through screening and regular checkups for both of these are vital for men. Mental health. Men are significantly affected by mental health issues, including depression and suicide. And yet, men will underreport the symptoms and they will avoid seeking help. And it's so sad to see that suicide remains a leading cause of death among younger men. Younger men, it's just really, really sad. So the idea is, it's something that has to shift, and we've got to encourage our men to talk about what truly is bothering them. General health and disease. 13.8% of men ages 18 and older are in fair or poor health, according to the CDC in 2022. 55% of men report not receiving regular health screening. And this issue is more common among men of color, as well as the 53% of white men not getting regular checkups, according to the Cleveland Clinic in 2022. In the same research, most men reported not being familiar with their family health history, like regarding urological issues and cancers. 77% had no idea of the urological issues, and 64% of cancer in their family history. Again, men are just unaware. Workplace fatalities are predominantly male, accounting for 92% of workplace fatalities. Crazy to me. This was reported by the Bureau of Labor 2022. Access to health care, which encompasses preventative services and management of chronic diseases, influence men's health. However, only 11.5% of males under the age of 65 do not have health insurance coverage. I know I've lived that life. There was a period of several years where I did not have health care coverage. So the CDC said in 2022, 11.5% of males under the age of 65 don't have health care coverage. Lifestyle and behavior factors such as smoking, which blows my mind that people straight up smoke a cigarette in which you light with fire. I know that vaping's a big thing, but it just still is disheartening the amount of people that still smoke. Drug use is heavier amongst men, and it affects men's health significantly. 13.2% of men ages 18 or older are actively smoking cigarettes, according to the CDC in 2022. And over a third of men, 34.1%, and over a quarter of women, 27.5%, are classified as overweight. The proportion of overweight men exceeds that of overweight women. This is a study done in 2018. In 2020, 28.3% of men ages 18 or older adhered to the recommended guidelines for aerobic and muscle strength training exercises. So it's pretty grim. The stats are, that's why I love the statistical data, just to try to understand. Let's talk about men's health and the suicide rates. This is pretty sad. In 2022, 15.1% of men ages 21 to 25 reported experiencing a major depressive episode within the past year. In 2021, among adults with serious mental health issues, fewer men with mental health received mental health treatments. 61.3% fewer men received mental health treatments than females experienced the same thing. That was 67.6% of women received treatment. Suicide rates have been particularly concerning, especially amongst white males, accounting for approximately 68.46% of suicide deaths in 2022. This means that in 2022, the suicide rate for men was 3.85 times higher than that for women. Firearms were involved in about 54.64% of all suicide deaths. And between 2001 and 2021, the overall suicide rates for men were 3 to 4 times greater than those for women. So suicide continues to grow, and the suicide rates are higher in rural areas in compared to metropolitan areas, 20.2 versus 13.6. So in rural areas, 20.2% of men commit suicide versus 13.6 in metropolitan areas. So the most common health concerns and cancer rate affecting men: 50.5% of U.S. men 18 and older have hypertension. They have high blood pressure. This is from the CDC from 2020. And the U.S. Preventative Service Task Force recommend men ages 18 to 39 have their blood pressure checked at least every 3 to 5 years. As I stated before, cardiovascular disease is the cause of death, the number one leading cause of death for men in the U.S. Oh my goodness. Also, unintentional deaths are also part of it, but high cholesterol, high blood pressure, poor nutrition, diabetes, and excessive alcohol use all contribute to the causes of death for men. So annually, more than 700,000 men receive cancer diagnosis, with nearly 300,000 succumbing to the disease. Over a lifetime, 50% of men and 33% of women will be diagnosed with cancer at least once. And although cancer can affect individuals of any age, the majority of cases occur in those ages 55 or older. And that was a statistic I did not know. They occur in people 55% or older. Now, in the United States, prostate cancer ranks as the most prevalent cancer amongst men, followed by lung and colorectal cancer, so colon cancer. So the fourth most common type of cancer varies by race. For Caucasian men, it's bladder cancer. For African American men, it's oral and larynx cancer. For American Indian Alaska Native men, as well as Hispanic men, it's kidney renal cancer. And for Asian Pacific Islander men, it's stomach cancer. Fascinating, fascinating, fascinating. So the idea that I just can't believe in this day and age, men are still smoking. At the age of 45, men have a lifetime risk for Alzheimer's of 1 in 10. 1 in 10 men at the age of 45 have a lifetime risk for Alzheimer's, which is crazy. Melanoma will impact 1 in 27 men and 1 in 40 women during their lifetimes. Additional research indicates that men are at higher risk for mortality from melanoma. Again, self-care, lack of sunblock, overexposure to the sun. So on and on and on. So these are the reasons why men need to really become highly aware of their health. Men and sexual reproductive health. I remember reading a statistic, I don't know, it was like 39% of all men at some time in their life will experience erectile dysfunction, and most of the time it's easily curable if they just go to a doctor and talk to about it. But men will suffer in silence and struggle unnecessary for years before they get help, and they've just wasted time. And it could be something simple, and I'm oversimplifying this, but it could be the fact that maybe they just need vitamin B. Okay, of the reported cases of sexually transmitted diseases, STDs, in the United States in 2021, women accounted for more chlamydia issues than men. In other instances, men have higher rates of STDs such as gonorrhea than women and primary syphilis than women. As men age, 32% of men express concerns regarding their sexual health, with 44% explicitly mentioning erectile dysfunction as their primary issue. So this is really cool because, again, in real time, working with real clients, men are starting to open up. I can't tell you how many conversations I've had when men are just blatantly say, hey, I need help with libido. I need help with, and we were able to have these conversations like, are you lacking in, is something happening with your erections? Yes, absolutely. Okay, great. Take this, try that. And it's so refreshing to just be able to have these conversations. In the past, it would have been unheard of to speak about this, but it's kind of cool. So half the men hold the misconception that low testosterone is the primary cause of erectile dysfunction. However, 71% of men who have encountered sexual health challenges have also received diagnosis of cardiovascular disease or diabetes. So testosterone gets a bad rap when it comes to erectile dysfunction in men, when it could be something related to their heart, or the driver could be diabetes. So men worry about various issues as they age, with the primary concern being their erectile dysfunction. I don't think this is a surprise to women, as we joke, we have the jokes about men and their little head and their emphasis on sex. But loss of sex drive, this is another conversation that I'm having in real time with men. It's like, they're like, I'm just not interested. But what's great is there's a host of products out there that are natural and clean and pure that can help support that and turn things around. Male reproductive issues account for over 1/3 of infertility cases. There's so many couples out there where, depending on the history, depending on the culture of the man, they will hesitate to go get checked out. it's an automatic assumption that it must be something wrong with the women. But 1/3 of men account for infertility cases. And the primary causes of male infertility often involve testicular function, hormone imbalances, or simple blockages in the male reproductive system. Approximately half of male infertility cases, the origin remains unknown. So there's more work that needs to be around male infertility as well. So let's talk about Fortune magazine talked about 5 symptoms that should prompt men to visit a doctor. Number 1, unexplained fatigue. From parenting and working demanding jobs to keeping up with friends and hobbies to caretaking of aging parents, routine life is demanding and exhausting. It's no surprise then that many men experience periods of higher levels of exhaustion. But if fatigue begins to feel extra crippling and chronic, it is most certainly time to seek out professional help, since there's a strong association with heart disease. One study found that men with moderate to high levels of exhaustion had a 2.7% fold increase in risk of heart disease within 5 years and a 2.2% higher risk within 10 years. The study also found a strong correlation between high blood pressure and moderate to high levels of exhaustion in 2/3 of the cohort. Additionally, fatigue is related to other serious conditions in men and especially associated with depression. Mental health is intrinsically tied to physical health, and research finds that in particular, depression is strongly associated with a higher risk of heart attack and stroke. But the good news is the studies find treating depression can directly affect heart attack risk, since depression often worsens lifestyle habits that are related to cardiovascular disease, such as eating a poor diet and consuming alcohol. Number 2, a symptom that should be taken very seriously is chest discomfort. A feeling of pressure and squeezing in the chest is a serious indication that medical care is essential. Chest pain and discomfort is one of the most common symptoms of a heart attack in men. It may occur during a heart attack because the heart, simply just isn't getting enough oxygen-rich blood. So this is a reason, if you start having chest pains, is to get it checked out. Sometimes chest pain and discomfort can be mistaken for other conditions, including anxiety and panic attacks, which God forbid if we talk about when it comes to men. But an anxiety attack can make a man feel like he's having a heart attack. But also a whole host of digestive problems and issues can also be the root cause. So the idea is, the theory is, anything with a head injury or chest pain or the heart, don't go to sleep with chest pain, thinking that it's acid reflux. It's better to be safer than sorry. Don't assume that you're also having a heart attack. Just go get checked out. Swelling in the lower extremities. Lower extremity edema or swelling is often a first sign of heart failure. That fluid that builds up in your lower legs, that builds up in your feet, your ankles, and hands, also known as pedal edema, occurs because the heart's ability to pump blood is too weak, which causes the blood to settle and accumulate in the tissues. So some research shows that the edema is a predictor of progressive heart failure. So if there's swelling in your lower extremities, please seek help. A change in exercise tolerance. We all have days when we have a lot of energy and, we work out and we just don't have the energy that we normally have. And sometimes going up a few flight of stairs may keep you winded or you feel exerted. But when you notice the exertion fatigue is more frequent and different than your normal baseline, it's time to see a doctor, guys. It's time to go get checked out. Shortness of breath is one thing that you never should ignore in exercise, because it can be a very important signal that you're blocking off your coronary arteries. So again, shortness of breath, change in exercise. And you can track your fitness performance. We have smartwatches. We live in a technology age. There's so many devices and things. Even your cell phone can track your heart rate and your pulse and all of that. And the final one, back to erectile dysfunction, loss of morning erections. Men often avoid talking about their sexual habits with doctors or seek out care if things seem to be off. However, one of the most important indicators of heart health for men is their ability to get and maintain an erection. Whew! So it all points back to the heart, and what these studies have not talked about, that in one future episode one day I'm going to talk about. I have an article or research that I've done, and I named it Men, Glorious Men. And it's about men not following their hearts. You know, men do a lot of social things because of keeping up appearances. But I honestly believe, and this goes for men and women, but overwhelmingly for men, sometimes men don't feel like they get to live from their heart because they're so busy achieving and striving and taking care of others. So men, I urge you, take these final days in this month of June to really look into your men's health. See a doctor, see a dentist, see an endocrinologist, and really take care of yourself. We need men on this planet, and you know, women are outnumbering men as it is, so I hate to see the numbers dip down from things that are absolutely positively preventable. As the opening statement said, this life is the only life you as yourself will ever have, and you owe it to yourself and the world to make the best of yourself. I close with that, everybody. Please take care of yourself. And one of the things that didn't come up was sleep, and we'll talk about that in another episode. But really, really take care. I honor you, men. I love you, men. Couldn't live with you, can't live without you. I close out on Namaste, and I'll catch you in the next episode of Astrodology with Astrid. Thank you for listening to Astrodology. If you enjoyed this episode and would like to help support the podcast, please hit the subscribe button and tell your friends about it by sharing this program on social media. You can also follow me on Instagram at Coda Life Goddess or at CodaLife.com. Coda is C-O-T-A, Coda Life Goddess or CodaLife.com. Thank you again for listening to Astrodology, and I'll see you next time.